Very pleased to have you all with us this morning. My name is Nigel. I'm the Deputy Director here at the GoLab. I'll introduce our panelists in a moment, but before I do, let me just tell you a little bit about the GoLab. So we're a centre of academic research based here at Oxford University. Our interest is in outcome-based commissioning generally, and we have a particular interest at the moment in social impact bonds. And we have a partnership with the UK government to basically increase the research base into social impact bonds. But research is not all we're about. So we're very engaged, and we like to, first of all, make sure that we're doing research that is really useful to commissioners and people working within the public services, making decisions about how to improve services. But also to make sure that any research and insights that we can gather, both from the academic literature, but also from the broader world of practice, are accessible and available to commissioners, decision makers and managers working within government, both centrally and locally. And whilst we do a lot of UK focused work, we do also seek to gather insights globally as well. We have quite a bit of support available. Of course, we do webinars like this one. This is our fourth. We've also had a webinar to launch our recent evidence report last month. And prior to that, we had webinars on procurement and setting and measuring outcomes. You can look at those webinars online. The recording is up online if you'd like to have a look at it. In addition, we have a lot of material on our website. We run advice surgeries, we do events, and we have a network of fellows of practice. So there's quite a range of support available to help people to engage with the research and insights that we have access to. In particular, I'll just mention another webinar that we've got next month on the 13th of November at 10 AM, which is measuring the impact of your outcomes-based contract with a particular focus on evaluation. So hopefully we can give you a good experience today, and you'll want to join us again next month. Okay, so let me introduce our speakers this morning. So first of all, I'll introduce Tim Gray. Tim is a consultant now, but has been a public sector commissioner, and in particular has done a lot of work in the rough sleeping and homelessness arena. He led on the first homelessness SIB for rough sleepers in London, as well as the MHCLG Fair Chance Fund, and currently the Brent Council Homelessness Prevention Social Impact Bond, and has provided advice to a number of upcoming social impact bonds in the Life Chances Fund. Catherine Remfry is an economic advisor within the UK government, particularly in the Department for Digital Culture, Media and Sport, and prior to joining DCMS, worked in the Department of Health and Department of Transport as an economist as well. And then Mila Lukic is from Bridges Fund Management, a social investor. Mila is a partner managing the Bridges SIB Fund, which is the first fund dedicated to investing in social impact bonds. And Bridges have a phenomenal amount of experience working in this way, in this particular contracting mechanism. So very pleased to have all of you with us this morning. Thank you. So just to tell you a little bit about who you all are, we have quite a nice slide, which I'll just get up now. So this gives you a little flavour of who we've got with us this morning. As you can see, a clear focus on commissioners in government, but also clearly some people from the provider space as well. So welcome to all of you. It is just worth mentioning that we do tend to come at things with the commissioner and government perspective in mind at the GoLab. So we're trying to get a range of perspectives in all of our work, but we're very much coming at it from the angle of how we can improve public services, which means often taking the perspective of government. We've had a lot of questions submitted in advance. Thank you very much. We will work very hard to make sure we answer those. You can see some of them up on the screen at the moment. If you have other questions during the webinar, please do ask them. You can do so by sticking them in the chat window, which you'll see in your Zoom window there. So please do just, if a question occurs to you, stick it up there, and we'll pause at various points throughout the webinar to take those questions. It's also worth saying about half of you are currently developing a social impact bond or outcome-based contract. So I suspect the issues that we're going to discuss are very live for you. Okay, so this is what we are going to cover. We've called this a webinar about setting up a payment mechanism. As we'll explain in a moment, there are many elements to setting up a payment mechanism. In particular, during most of this webinar, we're going to focus on the price setting part. How much do you actually pay for the outcomes you want to achieve, which can be, there are many different ways, let me just say, to come up with that price. And we'll discuss some of them basically by going through these three stages. So what's the starting point? What do you need to adjust the price for? And how do you do that together with the market, and why is that important? So this tool was developed by our academic team here and is really intended to give a shortcut mechanism for particularly commissioners or government managers who are thinking of setting up outcome-based contracts. And we basically say that there are three elements that are particularly important to focus on in the contract: specifying the cohort, number one; number two, specifying the outcomes; and number three, getting the price right. And this is, again, just to reiterate that we're going to focus this morning particularly on the price section. Obviously, the outcome section, as I mentioned, we have done a webinar on that already, and we have some technical guidance on the website related to that. So feel free to look into that. Okay, so what is a payment mechanism? Kat, I'm going to turn over to you for this one. And if we can just show the slide. There are many elements to a payment mechanism. Yep. And what we've done here is try to boil those elements down into a sentence. And this is the sort of sentence that you might put into a contract or into the payment schedule within an outcome-based contract to describe the terms against which you're going to pay for a particular outcome. So maybe, Kat, you could just talk us through the different elements.
So as Nigel said, these kind of the important elements that make up a payment mechanism. And it's important to think that here that a payment mechanism might not be your kind of the totality of payments, but may just be an element of it. And you may have multiple payment mechanisms for different outcomes that you want to pay for. So I kind of see it as a set of rules that explains the entire kind of point of your project. And it covers kind of who, what, when, and how. No where, unfortunately. But so when we think about the what, we're thinking about the kind of overall impact that you're looking to achieve. So that's the desired outcome, the light blue box, the level of improvement or the change that you want to see. So that's the kind of beige color, and how much you're willing to pay for that. So that's the blue box that we'll be talking about and focusing on today. It shows you who you want to provide this service for. So that's the orange, a clearly defined cohort that you want to receive the service and hopefully see the improvement or change occur to. It tells you how you're going to go about seeing if this change or improvement has occurred. So that's the purple. And it also shows you the measurement for kind of additionality to make sure that that change has happened to someone that it wouldn't have happened to anyway. So that's the maroon one at the bottom. And finally, the green shows you when, so how often you're willing to pay for the outcome, whether that's kind of at the end of the project or at set points throughout.
And I think just to bring this to life a little bit, on the next slide, we've got an example which hopefully might illustrate what these different elements can look like in practice. So this example is from probably the most famous social impact bond, which was the first and is very well known. So we've used this one for that reason. And that's the Peterborough Prison SIB in the UK. Maybe, Kat, could you just talk us through this example and how those elements look like for Peterborough?
So here we can see what the SIB aimed to do. So the light blue, it aimed to reduce reoffending. And what they wanted to see was a 7.5% reduction, and they were willing to pay an unfortunately undisclosed amount in this instance. Who they wanted to pay for is these 1,000-person cohorts of ex-offenders who've been in prison for a year or less. And the way they were going to go about measuring that was to look at data on number of reconvictions. And they did that by looking at the data for the cohort defined in orange, and also a matched comparator group, to ensure that the change that they were paying for wouldn't have happened without the service anyway. And that was paid over a 3-year time period.
And I think that this example just illustrates how much work often needs to go into developing a payment mechanism, because there are an awful lot of elements in there to get right. It's not just about figuring out how much you're going to pay. You've got to work out how to define the outcome, how to measure it, what level of improvement you're expecting to see. There's an awful lot of different elements to work through when you're going about setting up a payment mechanism.
And I should have said that all of these elements are going to interact with each other. So you might have parts in here that are looser, we say, or tighter, which may then mean that you have kind of looser or tighter other elements, especially when we're thinking about the kind of the additionality bit, the purple box. If you've got a very kind of tightly defined cohort, you might not need to have that test pinned down quite so much, because you know that the change will happen to those people.
So we will be touching on a few of those issues later on in the webinar, but as I've explained already, we're going to focus on the pricing element, and we'll bring in those other aspects, but obviously there's so much to cover there, we can't really tackle it all in one webinar. And for the particular other specialist areas like measuring the outcomes, we have other guidance available. So let's turn to this issue of pricing then. How much am I actually going to pay? You know, if I've worked out what the outcomes are, how to measure them, and who my cohort is, I need to figure out next how much to pay. So where do you go to find that out? Basically, that's what we want to try and work through this morning with our panelists. And we've broken it down sort of into 3 bits, really. And these are not necessarily sequential. This is always going to be an iterative process. There are many elements to going about setting price for an outcome. But we've basically broken it down into these 3 different stages. So what's the starting point? We'll talk a little bit about some theoretical processes you can go through to give yourself a starting point, a number for an outcome, basically. And we'll think about different ways to get that starting point number. Then we'll talk about adjusting that number according to different factors and different elements. And in the brackets underneath there, you can see what some of those elements are. You know, the price will vary according to how much you expect the cohort to improve and how complex they are to start with, and other aspects. So we'll explore those a little bit. And then very importantly, this point around engaging the market. So in any commissioning, in any contracting, it's really important to engage the market and make sure that you're letting a contract that's viable for a market participant to deliver against. And that is certainly no less true in social impact bonds, and in some ways probably even more true. So we'll explore those 3 issues a little bit more. But first, because some of these concepts can often be quite abstract, and also because we've got such a great variety of experience here in the room, we thought it would be really interesting to start simply with hearing sort of end to end the process of designing a payment mechanism and pricing an outcome in a specific example. So I'd like to turn over to you, Tim, if you can talk us through, from your vast experience, a specific example of when you've had to do this and how you went about it.
Okay, so perhaps if I talk about the Fair Chance Fund that we ran from central government department, Ministry for Communities and Local Government in Britain. And basically the situation there was that we were working in homelessness. I was part of the homelessness department, and we wanted to do something effective on youth homelessness. And the way these things sometimes work is that somebody decided, well, we'll give you some money to spend on youth homelessness over the next 3 years in the spending round. You know, if you can do that in a way that's going to be as effective as possible. And there was quite a lot of interest in the department at the time about doing a social impact bond, because we did have some experience. We'd been involved in the rough sleeping social impact bond in London. And so basically we had an amount of money to start with. So we had 15 million pounds actually we had. And we thought, well, so first of all, we talked to the people who were experts in that market to say, well, look, if you're going to do something in youth homelessness using a social impact bond approach, who's the best group to work with? And what it emerged was that there's a group of people who previously basically were falling through the system. So actually the young people with the highest needs sometimes just don't cope with existing services like supported housing or day centres or youth employment services or those kind of projects. Because they're too chaotic, or the services don't suit them, and so people fall through the net, and they end up getting no service at all, and probably other people are most likely in the future to end up costing the state a lot of money through crime, health issues, substance abuse, and so on. So an outcomes-based approach seemed a good way to work with that group, because they're such a disparate group. And we knew we had £50 million, and we managed to persuade our friends in another government department in the Cabinet Office to let us have another £10 million to work with that group. And so we knew what we had, but we wanted to see, well, if you've got this really hard to help group, what is it going to cost to really turn their lives around? Because that essentially is what we're trying to do. We were trying to use the outcomes as a way of saying, well, by the end of this process, if the social impact bond has worked with you, you should have a much better chance of having a sort of stable future going forward in terms of accommodation, employment, not being a burden on the state, and so on. And we just talked to a lot of people about it. So we talked to the Department for Work and Pensions about employment outcomes and what they ought to be worth for that kind of group. And that was partly based on work that they had already done in a sort of more generalised context about, if you get somebody who's been unemployed for a long time into work, what is the saving to the public purse? Now, that doesn't necessarily correspond exactly to this group, because they've never done specific analysis on this group. But if you take that analysis and you think, well, that's multiplied by a factor of some kind or another, because this is a very hard group and they're likely to benefit more over the long term from being employed in terms of savings to the state than others. We also talked to the voluntary sector who work with that group already. So there'd never been a social impact bond doing this exactly, but we did want to talk to people who had experience of working with that group about how best should we be designing a programme for them, what should we be paying for, and broadly, how much is it going to cost per individual to do enough with that person to really change their life. The feedback that we got from that conversation was that the key elements for this was a group of people who are homeless, was that we would want to make sure that they were in stable accommodation. So they're in stable accommodation. It could be different types of accommodation, but it had to be something that lasted for a period. And we wanted to do something that would get them into jobs, because they're young enough, basically, that there ought to be a chance of getting as many people as possible into jobs. And those things would also be proxies for dealing with the sort of chaotic lifestyles that some people had, mental health problems, substance abuse problems, and so on. So we settled on the type of outcomes through that dialogue, and there being hard outcomes that could be measured. And in terms of the amounts, we based the employment outcomes basically on what the DWP said to us, as I mentioned. And we based the accommodation outcomes, the sustainment of accommodation outcomes, partly on the social impact bond that had already happened with London Ross Sleepers, who are a similarly chaotic group, although older, perhaps a more chaotic group. So it was partly we had those starting points, but also talking to the voluntary sector about, well, how much would it cost you actually to deliver this kind of service? And then, before we actually got to the point of setting outcomes prices, we talked quite a lot to social investors as well. And you have to bear in mind that social investors at that point didn't know anything about this group at all, so they didn't know what it was going to cost to achieve these outcomes. And they were, understandably, because they were putting their money on the line, nervous of taking too big a risk. And so we designed the outcomes to spread the money that we had available between the outcomes that we really wanted to see in terms of actually getting people into jobs that they could sustain for 6 months, and into accommodation over a 12-month period, to things that actually the social investors felt was not too much of a risk for us to pay for. And so we staged some of those payments. So we staged the accommodation payments, and we staged some of the employment payments. And that's essentially how he did it, sort of jiggling the numbers around to get something that felt right to us in terms of we're getting value for money, because this amount of money for this group of people is likely to be a lot less than they would cost a public purse if we were not to work with them at all. And with the social investors and providers in terms of what could be delivered. So that's got all of those elements in it that were just described, but it wasn't a sort of neat and tidy process of saying, well, then we'll start at the beginning and then we'll work all that out and then we'll go on to the next stage and the next stage. It's much more of a to and fro. And probably we ended up paying too much, frankly, because we asked people what they thought was reasonable. And of course, people will say a little bit more than they think it's really going to cost. But actually, there was quite a lot of risk involved because this was a new thing. And it was probably better to pay a bit too much rather than too little, because it really got a lot of interest in the programme and it really got people to put a lot of energy into it. So that if we were to commission it again, as I think is being considered, one would probably start with a bit of a lower outcomes price because it's now better known on what it actually cost to deliver those outcomes for that group.
Mm.
I think that's really interesting, sorry to jump in, that on reflection, the commissioner has now updated what they think their starting point and their willingness to pay for that outcome is. And they'll go through those stages again to kind of make sure that providers, investors and commissioners are happy. Yeah. You're still kind of coming back to this process.
And just if we can go back and look at what those three stages were, because I think as you both just said, it's clear that this is a messy process. We've heard Tim, you talk about all three of these things, getting a starting point by talking to various different departments, understanding the sort of value of the outcome from a sort of public perspective. Lots of market engagement, both with providers and investors to understand the cost of delivery and also adjusting the price around aspects like the timing of payments, and having to take into account things like that. So it's a really good illustration, I think, that of what a messy process this can be, but it's got those ingredients in it, and you couldn't have done it without, if you'd missed out any of those three aspects.
No. And I think it's fair to point out, though, that we were in a position where we had a budget to spend something on homelessness. So if we could only spend money that we were sure we were going to get back through savings in, say, 1 year or 2 years' time, we'd have had to be, much more prescriptive, perhaps, about how much we could pay overall for the outcome. So it does depend on what your starting point and where your budget is coming from and what your budget's conditional on as to what you can do.
Exactly. Yeah. So we'll move on in a moment to talk about the starting point, because it is really important and very much linked to what you are doing the SIB for and what your purpose is in doing the social impact bond. But just before we go on to that, shall I just pause and see, do we have any questions from the audience? Not yet. Okay. I hope that means that everyone's following along and understanding everything really well. But please do ask questions if any occur to you as we go. So yes, starting point. So as you've pointed out, Tim, the starting point you use for pricing your outcome very much depends on your objective. And in the example that you gave, there was budget made available to do this work. And that may well be true in many social impact bonds, but in some, that won't necessarily be true. The social impact bonds will be using existing budget or might be being used to recommission an existing service or commission a service around an existing sort of desired set of outcomes. So to explore those issues a little bit more, we sort of boiled down the starting point into sort of a few, I suppose, theoretical aspects that you can use to start off this, because sometimes knowing where to start is half of the battle. So I'm going to ask you, Kat, just to talk us through these, and then I'll ask Mila and Tim just to reflect from your own experiences as SIBs, which ones really sort of you've used or seen.
Yeah, and I think again it's important to come back to the fact that we're thinking about commissioners, and obviously these three steps start with the commissioner working out how much they're willing to pay rather than it being a provider-led thing. So as Nigel pointed out, I think there are a few kind of theoretical approaches that we've seen used in different SIBs, and they are very linked to the motivations that commissioners have had for doing an outcomes-based contract. And also we'll see those three approaches overlap. So the three broad approaches are the kind of the value to society, the efficiencies or achieving greater value, and the prevention or moving provision upstream. So I'll just quickly explain each of those. So the intrinsic value or the value to society of the outcome, this is probably the most theoretical, and as we've seen from the Fair Chance Fund, is probably the starting point for more traditionally in central government, because it's based on social cost benefit analysis, which is kind of economist bread and butter, and it looks at the kind of impacts of that outcome and tries to work out what the benefits are of those to kind of the whole of society. So the individuals, the kind of public sector organisation paying for the outcomes, maybe other public sector organisations, so DCLG we're looking at, or MHCLG, we're looking at the impact on DWP. It tries to quantify all of those impacts and then attach a monetary value. So in some aspects that's easier, because DWP could think about the price saving further down the line of kind of a young person who wasn't in employment. There's also some kind of like economic trickery in some of the social impacts, where they're not tied to prices paid by social sector organisations. And I mean, there's lots of literature out there, and the GoLab will be thinking about guidance, simplified guidance for people on that. So once you've got that kind of total value to society of an outcome, the commissioner might then decide whether they are particularly interested in paying for the whole of society's value, or actually they want to kind of really drill down on certain aspects of that. So it might be that DWP were willing to pay the saving of one less kind of JSA payment, or it may be that we actually want to pay for a larger amount, because we consider that the value to the person from not being unemployed means that it's a gross value.
Sorry, Kat, JSA is... Sorry,
Job Seekers Allowance. Oh no, I've done the civil service thing and gone into acronyms.
Yeah, so that's an employment benefit.
Yes, so, and that cost would have fallen on DWP. Okay.
Department for Work and Pensions.
Oh God.
He's a leader.
So Tim did that first, actually.
To do that. I got away with it.
Yeah.
Okay, so the second one is kind of efficiencies, and trying to achieve greater value for every pound spent. And this might be more speaks to Tim's second point, where you haven't got that ring-fence budget that you can just kind of push out the door, and you're looking for those savings. So it's kind of useful if you think that your current services could be done for a lower price, or if you think that the quality of outcomes could be pushed up for the same price. And this involves a commissioner really getting to know the kind of price, the quality, the quantity, the types of outcomes that are being achieved for their current services, and then redesigning those to change the incentives to either drive down the price or push up the quality in an outcomes-based contract. And the third one we kind of spoke about is the prevention, or trying to move that provision upstream, which also speaks to the savings. Because you're trying to prevent this kind of future social problem, which has a kind of cost attached to it. This is kind of useful for commissioners when they've got constrained budgets and they want to kind of focus on the preventative results, but they need their current budgets to support people with that immediate and urgent need. And while we all recognise that kind of preventative is a better outcome for people that we're trying to help, and is more cost effective, it obviously may become second down the list when you're looking at those immediate problems. So this kind of approach would need commissioners to identify what those social problems that they are trying to reduce, and trace back to look at the causes and the kind of pattern of need going forward, so that you can identify where an intervention could reduce that social cost or social problem further down the line. Obviously, again, very interlinked with the other approaches we've talked about, and the not in employment, education or training example does speak very strongly to this point, because we do have kind of a very clear set of costs to public sector organisations from unemployment, and it's kind of easy to think about, if you were tracing that back, actually where does the root cause of that come from? It could be, a very young age, and potentially the prevention falls within a school budget, but the benefit is then falling to DWP. So when we think about the kind of approach here, you may even find as a commissioner, having done that analysis, you can go out and target other commissioners, and you end up in a kind of co-commissioning relationship. So I think they're the kind of three main ones that we've seen today.
Thanks, Kat. So let's talk about a few examples to bring that to life. Tim, obviously you've already talked us through the Fair Chance Fund, which seems to rely on the first, the intrinsic value of the outcomes. But obviously, if you were to really price the value to society of getting someone who's sleeping rough, into accommodation and into employment over their lifetime, the benefits to society are huge. Never mind the benefits to the individual. We're not suggesting you would pay that to a provider, presumably.
No, I don't think you should pay a provider, more than they need in order to be able to deliver the service and make a return on investment that's commensurate with the risk that they're taking. I mean, I suppose Fair Chance Fund is an example of where actually you are saving money through prevention. You are actually doing some research and development in terms of trying something out to see what it costs to be able to do it again better later, and you are hoping that by having an outcomes focus, it's doing something more efficiently than it would be done if you were just doing it on a fee-for-service basis. And in this case, it'd be very difficult to do a fee-for-service basis because there's no particular service that you could specify for this disparate range of people. But in terms of setting the price, I think you're right that we did do it more on what we thought the intrinsic value was, because we weren't able very tightly to quantify what the savings would be over the long term, and we had a pretty good idea that they would be pretty substantial and much more than we're paying through the outcomes. But in terms of actually pinning it down to a number, that would have been very difficult. So to a certain extent, it was on trust and on the basis that we had some money to spend on homelessness anyway, because society wants to do something to reduce homelessness in its own right.
Let's turn to you, Mila, because you guys have got a lot of experience running many different types of outcomes contracts in many different policy areas. Which of these approaches have you seen being used as starting points for pricing the outcomes?
Yeah, no, absolutely. I think it's really helpful to talk through the Fair Chance Fund example in a lot of detail, because it is a very good example of thinking about how to actually engage a range of stakeholders to come up with ideas and answers. And I think from our perspective, certainly what we've seen over the last 6 years is that what has scaled and what is working as a partnership is really the improvement and the efficiencies point. And it is around the partnerships with local authorities. And from our perspective, what we focused on primarily is work with the local authorities and work with the local government. And there, what we see is that the approach that works is looking at what is happening right now, looking at the current contracts, thinking about the need within the current contracts, and trying to figure out a simple and clear way of how incentives can be redesigned, exactly as Kat said, to actually drive better quality, to drive more outcomes, and to drive further impact through both increasing the level of impact achieved, but also through increasing the length of it, because you are focusing on long-term tracking and you are focusing on a much longer-term outcome. So I think from our perspective, it can be, and what we've seen work and gets replicated and gets scaled, is that focus on, okay, let's look at what's in front of you. Let's really analyze the spend on your current services. Let's identify very clearly where the main need is, who the main cohort is to focus on, and then within that cohort and within the spend that sits around that cohort, how can that be improved? And I think that what's key there is to really be very clear, to try to create something that can be very simply designed and arranged, because we talk about data-driven decision making, and I think that absolutely all of this work is contributing to that and improving the data that's available, and our understanding around what's the art of the possible and what's actually what can actually be achieved. But the reality is that at the moment the availability of data is varied. And so I think we still have a long way to go on improving all of that. And all of this work is contributing to that. But in terms of kind of creating a silver bullet solution and an ideal situation of something that marries up, the intrinsic value and the prevention and the efficiencies is hard. And so really thinking about, well, what's in front of us, how can we analyze that? create the right benchmarks to understand what can be possible, and then how is something designed that can treat, if a team can treat 40 families or 50 families, how can one design incentives so that that's achieved versus what may be happening today, which is potentially lower level of impact, lower level of outcomes, and a smaller number of beneficiaries worked with. So I think that from our perspective, certainly that is something that we've seen work quite well, and something that we're seeing scale, and what we've been focusing on over the last 5-6 years.
And just to bring it to life a bit, can you give us a specific example of where you've seen that approach really work effectively?
Yeah, no, absolutely. I mean, I think that certainly we've seen that with a lot of the children's services projects. So a lot of the projects which are focusing on looked after children, so either children in care or children at risk of going into care. So for example, and I think it's really interesting because actually you can create projects which the starting point can be the analysis of the current delivery, current spend, and current achievement, but actually it is done together with a view of prevention that can be achieved. So I think, for example, for the projects that keep the families together, what one can look at is for the existing educare services, so services that provide support for families to stay together, the benefits being young person not going into care and therefore not incurring the costs that are associated with that. There are, at the moment, there is a range of services that deals with similar cohorts. So now within that's quite a broad category of different types of problems. So it is important to identify quite clearly what problem is one focusing on within a family and within the young person. But once that's identified, then there is actually quite a clear evidence base of the delivery that's taking place right now and the spend that's taking place right now on different services. So what can be done there is to basically look very clearly at, okay, let's look at a specific team, for example, multisystemic therapy team. So that's one of the examples of the interventions which are being delivered for this cohort, or functional family therapy team. There are over 20-30 of such teams here nationally in the UK, and a range of examples internationally. So one can look at the achievement of the delivery in those cases, and then one can look at, okay, well, what does the best possible team actually achieve? So let's design incentives, and let's design a contract that actually incentivizes that achievement, so that highest achievement or even a bit better. And so, because that it is possible, and the point is actually managing that process from day one. So that is one specific example where it's quite clear to understand what is the level of achievement that's possible. It's quite clear to understand what is the spend, or what is the cost that would be associated with that, and then basically designing an actual outcome framework and an actual pricing that incentivizes working with 40 families rather than 25, because if you only worked with 25 and if you only got paid for that, that wouldn't cover your cost base. So, you would be in the negative and the project would be in the negative. So quite clearly you can design such incentives.
Okay, great. So what we're talking about here really is that if you're in a situation where from a commissioner perspective or government entity perspective, you can see what outcomes you're currently getting from a particular service, then potentially you can use the outcomes-based contracts to get those same outcomes for less, right? That's the basic principle here. So in the example,
well, I suppose from our perspective, what we like to focus on is maximizing the impact. So I think the point is that actually you would want to be delivering more outcomes or better outcomes for the same price potentially. Right. Or the point is that your price per outcome ends up being lower than what you're paying right now. So that is the key analysis.
So it's a way of driving efficiency.
And I think that's where we come back to the fact that the payment mechanism includes all of these different elements, because one of the ways that you might drive that is that your current service might be treating, a a number of people who would have gone on to achieve those outcomes anyway. So when you then move on to the outcomes-based commissioning and you're defining who you want to receive that service, you're paying maybe even more for the same outcomes, but the people who actually need the service are getting it, so it's cheaper overall.
Yeah.
And I think if you're designing the outcomes payments for a service, like if you've got that sort of starting point, so that you know what you're paying for a certain number of outcomes already, then what you would aim to do is to design it in such a way that the investor can only, get their money back or make any return if they do better than the current services, which is possible to achieve in the design, especially when you have that level of information to begin with.
Okay, so I mean, hopefully, what this discussion is illustrating is that the method you choose as your starting point for pricing the outcomes is very dependent on what you're trying to achieve through the outcome-based contract, and that can be several different things. And I think the examples we're discussing are illustrating that point. I guess before we move on, something else we ought to just reflect on is the fact that when social impact bonds were in their early days, it was often this prevention and cashable savings argument that was most used. So the idea that you described last, Kat, which is that you can do a root cause analysis and put an intervention in upstream, as we say, or at an earlier point to prevent a costly problem from ever emerging, and use those savings then to pay back the cost of providing that upfront service. But clearly, other approaches have been used. Is there still merit in this prevention approach? Have we seen that being used again? It was used, for example, in the Peterborough Prison social impact bond, because it was all about stopping people coming out of prison from ending up back in prison, which is very costly. Have there been other examples? You mentioned youth unemployment, Kat.
Yes, I think youth unemployment, but also to reflect on the Greater London Authority, they also did a kind of cohort analysis of the financial impacts of rough sleeping, and that included things like criminal justice costs, the healthcare costs, I've lost it now, unemployment costs, and they kind of summed up that business case and analysis and came up with a total value, and then used that to kind of cap the outcomes that they were willing to pay. So even though it wasn't, it's £68.78 kind of analysis, they used that overarching picture to know that was their kind of upper bound that they were willing to pay, and that was kind of the cap that they set. But to reflect on the kind of youth unemployment and the kind of initial findings we're seeing out of the Youth Engagement Fund, which was a Department of Work and Pensions run, not an employment education and training programme, was that the kind of pricing was very much driven by the cashable savings modelling. And although we haven't got the kind of full impact analysis yet, there was kind of indications that cashable saving then wasn't actually enough to cover the service for those that were hardest to reach. And for that reason, some of them got left behind, basically, because providers didn't see the kind of the value in treating those who would cost more than the outcome was worth to them. So I think a kind of reflection from that is that it's very important to start with the kind of what the commissioner is willing to pay, what the commissioner is going to get out of achieving these outcomes, and then it's the iterative process about making sure that works for the provider and the investor. I think in the Youth Engagement Fund, either changing the value or reflecting on whether the cohort maybe needs to be defined slightly differently, so that your price was set differently for those harder to reach.
Yeah, I think it is. So firstly, reflecting on Peterborough, I think that it was the first project, the first SIB. Many countries copied it, but actually, it is in practice what we've seen is that model is not necessarily what gets replicated, and there are a lot of reasons for that. And as I said, what we've seen getting replicated and what we've seen created are different models and are different types of discussions with the local government in particular. So I think from our perspective, we kind of didn't focus on that, and we focused on different types of approaches. But I do think that I don't think they're mutually exclusive, and I think actually the central government can do a lot to really push the thinking on exactly the analysis that Kat and Tim described, because actually I do think that that's where, you know, that view and that analysis can be done on the central government level and can identify then quite clearly how do you actually pull the budgets and who are all of the different beneficiaries. And there can be, you know, the right signaling and the right engagement then between the central government and the different parties, both on the local level, but also within the different central government departments. And so I do think that there is definitely thinking around how to do that, and there is definitely need and space to do that well. I think that then, you know, thinking about the reality of what is the spend on the local level, what are the needs on the local level, and how do you continue, you know, in parallel pushing that forward. And I think that's where being, you know, really clear and really practical and pragmatic about solutions is really important. And I do just think that it is also really key to continue because we've seen a number of examples on the local level where the prevention argument was one that people use to think about budget creation, and that's in many cases is not practical, because actually yes, the savings will be achieved and that's what one wants to achieve, but, you know, assuming that the whole contract gets delivered from the actual cashable savings release over the course of 7 years, it only works in a small number of examples where the budgets are structured in a way where that's enabled, and in a lot of cases the budgets are not structured in a way where that's enabled, and that therefore doesn't work. So I do think that that has to be quite carefully thought about and managed, in particular at the local level.
Yeah, can I just just in the interest of time moves on, because we're going to go and explore some of these issues a little bit more in a moment, particularly I think, Mila, because you talked about looking practically at what the situation is on the ground, and that's really, really important. I think, you know, these are starting points which are quite theoretical in nature, and you quite quickly have to move into a process of refining that number, taking into account various considerations. We've also had a few questions. We won't have time for that many. There's a couple about engagement with the private sector, engagement with the voluntary sector. We will come to that later, so we can come back to those. Perhaps we can just pick up one of these other points briefly. There's actually a couple of related questions there about innovation, the flexibility and the value of innovation to a commissioner if the outcome-based contract is trying to incentivize greater innovation, and related to that, a question about the cost of development and whether that can be built in. And we haven't spoken that much about innovation as a sort of starting point. The cost of innovation, the cost of development, can that be used as a starting point for pricing an outcome? Any views, Tim, maybe?
Well, I think obviously one of the potential advantages of having an outcomes contract in the first place is that you're not specifying, you know, a particular service. You're saying, well, here's a set of people that we want to achieve outcomes for. You tell us how you think you're going to do it, but actually we want to allow you scope to change that as you go along and to try different things. Or you may be trying something innovative in the first place that might have worked in another context, but not in the context that we're paying for the SIB for. So I think, yes, inevitably there is a risk that goes with innovation, you know, and you might try things and get them wrong. So you might try something out as part of the SIB, you know, which actually doesn't work. And the beauty of the SIB is that you can then adjust what you do according to what does work. But clearly that's a cost that's been incurred. And I suppose that is priced. It's got to be priced in to what you're willing to pay for the outcome. Otherwise, the investors and the providers wouldn't be able to innovate in that way. There's another argument, though, to say that you know, if what they're getting paid for is the outcomes, then it may actually be cost effective for providers and investors to innovate during the service, because that actually gets them better results than just sticking with the thing that they thought in the first place. So it doesn't necessarily add cost to allow innovation.
Right.
And I would maybe reflect that it isn't necessarily a starting point for pricing, right, but as Tim's kind of alluded to, it it becomes an adjustment or a kind of top up that you need to put on that value that you come up with at the beginning.
Okay, well, let's move on to exactly that topic then of adjustments for practicalities. So we've sort of come up with 4 factors that you will need to take into account when adjusting the price. Now, inevitably, when we're discussing these, we're going to start talking about engaging the market, which we'll talk more about in the next section. But of course, as we illustrated at the start, none of these things are done in isolation. They're all done in a linked way. And we've already touched on some of these issues already. But I think let's just go through them one by one and just try and explain what we mean by each of these 4 adjustments and how these 4 factors affect the price that you pay per outcome. So I think we can go through and ask, I'll just ask each of you to explain a different one, I think. So Tim, could you talk to us about the level of improvement and how the level of improvement that might be expected for a cohort affects the price that you might pay?
Yeah, so I guess there's more than one way of measuring outcomes, and it depends you know, on what you know about the cohort and what data you have. But a good way of really measuring the success of a social impact bond is to take the you know, the baseline starting point of where you were with a particular issue, and to say, well, you know, we'll pay if it improves by a certain amount. So, for example, with the London rough sleeping SIB, we had data. It's quite unusual in the world, but in London they did have data on, you know, if you take a group of people who've been sleeping rough on the streets, who met certain criteria in London over the past 2 years, and you let the current service landscape go forward without a different intervention, then you would expect actually rough sleeping amongst that group to drop, but not to drop enough. So we had something that we could say, well, actually, we will pay according to how much faster rough sleeping drops with that group compared to what we would have expected with the status quo. Now, it's difficult to do that perfectly because, you know, there are always changing circumstances with time and you know, other services that may come on and off stream and so on. But nevertheless, that's quite helpful, and it does mean that you have to do something that works with the whole group. There are other situations where you're paying for an individual. So, for example, if you've got a homeless person who, you know, you might want you want them to be in stable accommodation that they're going to be able to sustain off and on, you know, for the rest of their life, because you've given them some of the skills and abilities to be able to do that. But obviously you can't wait until the end of their life to pay for the outcome. So you have to do some sort of proxy which suggests that it's going to be true. So you might have say that you want to pay for people to sustain accommodation for 18 months as your real outcome, but you might have to pay for something about people sustaining accommodation for 3 months or 6 months in order to get investors to take the risk. And what that also does is it means, addressing a little bit Kat's points earlier about the Youth Engagement Fund, where harder to help people were parked, perhaps, is to say, well, look, you know, we think we can get this person into accommodation for 3 months, even if we don't think we're going to be able to do it long term. And so it's worth putting the money in and the investment in to try and achieve that shorter term outcome. And then hopefully with most people, you will be able to go on and achieve the longer term outcomes. But if you'd only had a very, you know, hard outcome that was very long term, then you might have said, well, actually, we don't think it's possible that we're going to make any money out of this very hard to help person, so we're not going to deliver the full service to them. So designing outcomes in that way is important, and spreading the you know, the payments over, you know, a range of steps towards that outcome can sometimes be helpful, but you have to balance it against well, how much is actually somebody staying in accommodation for 3 months and then becoming homeless again worth to you? Probably not very much. So there's a balancing act to be had there. And also, you know, if it's all possible, you want to have an idea where you're encouraging the provider to work as hard as they can to achieve as much as possible with everybody in the group. So, so in that rough sleeping SIB, we had some chronic rough sleepers who'd been on and off the streets for years, and we had some outcomes that were really designed to help the hardest of those people. For example, this level of rough sleeping after a certain number of months, we wanted to reduce it, and we designed that in such a way that they'd only really make money if they got nearly everybody off the streets quite quickly. So you had to help work with the people who were really difficult in order to make money on that outcome. On the other hand, we had another outcome, which was about getting people into employment. Now, getting chronic rough sleepers into employment that they sustain is really difficult, but there were some people, depending on the circumstances as to why they were on the streets in the first place, who actually, with a bit of a nudge, you can get into a job. So we wanted to make it so that if somebody we got off the streets quickly, then you would have an incentive to do something more with them to improve the value of the programme, rather than just getting them off the streets was sufficient. Similarly, we tried to have an outcome, there's some issue with it, but we tried to have an outcome about reducing accidents and emergency emissions for that group, which was about, which we wanted to base on the statistics for the previous year for the whole cohort, and then see, well, let's have a statistical improvement on that, which will give different gradations of outcome payment depending on how well you do. And the point of that was that we wanted to make people work with the sort of very chaotic sort of frequent flyer people who are in and out of hospital all the time, because they get into fights or they they get very ill and go into hospital. So it's trying to design your outcomes to incentivize the right behaviours and being really sort of thoughtful about that and how it's going to work with different segments of the cohort, so that you don't end up with this, parking, creaming, cherry picking stuff.
So I think what you've illustrated there, Tim, is that actually these four, you've mentioned.
I mentioned all of them instead of just one.
You have, and I think that, but I think that's actually goes to show that there's not. This is not a simple case of saying, if we expect a greater amount of improvement, then we should pay more, because you have to take into account that will only apply to certain parts of your cohort. So your cohort specification really matters. And you've also mentioned timing of payment, and the fact that you can put these shorter term outcomes in the middle. I think the point being that, that can ultimately make the contract cheaper, or mean you can reduce the outcomes price, and we'll explore with you, Mila, in a moment why that might be. But the point is that when you're setting the amount you pay for the outcome, it really is interlinked to the overall payment mechanism, and you have to make these adjustments in the round. You can't just look at the amounts and expect that to do all of the work. You've also got to think very carefully about what the outcomes and cohort members look like.
I think that's right. And I think it's also worth mentioning that you can cap outcomes payments. So most social investors will be okay, so long as if they get a certain amount of outcomes, they'll get their money back and make the return that they want. They don't necessarily want more money than that, and so it's possible to cap the total amount of outcomes payments that you would pay in any circumstances in order to limit your budget. So if it's wildly more successful than you thought it would be, that doesn't necessarily mean that you have to pay wildly more money than you've got in your budget. So there are things you can do around setting caps.
Yeah. Mila, what are your reflections from the sort of investor side, or from the other side of the table, on why these different adjustments are important?
Yeah, no, absolutely. I think that the cohort specification is so incredibly important, and getting that clear from the beginning so that everybody's completely on the same page around the expectations, around the focus, and around the art of the possible in that particular case. I think that's really, really important in figuring out what's the outcome framework and what the pricing is, but also then for the operational delivery over the course of the contract, it's critical. I think that's the level of improvement, as Tim spoke about, and as Kat also addressed earlier on. I think there needs to be there needs to be ability to, or incentive for overperformance, because otherwise the incentivization around actually innovating and trying to do things better, it just doesn't exist. So there needs to be recognition that actually if you do better, and if this really does a great job, then yes, there is a recognition that that there is a benefit associated with that. So I think that's really important. And in terms of the timing, so I mean, Tim broadly addressed it already, but I think I mean, quite simply, if you are trying to think about an outcome that's being delivered in 5 years' time, nobody knows what will happen in 5 years' time. So you're trying to build in a risk premium for the fact that maybe, you know, the local commissioner will just be completely differently structured to the actual, you know, risk around the delivery. So obviously well, not obviously, but what you end up with is a success rate that kind of accounts for all of that. So you can say, well, you know, in 5 years' time or in 7 years' time, we expect to achieve 50% of the outcomes, let's say. However, if you are graduating that, and if you are spreading that and identifying the right lead indicators, then you can be much more confident around the success rate, and therefore the premium that is being built in for that is lower, and ultimately the price per outcome ends up being lower. And so I think that's in kind of financial terms, but much more importantly in operational terms, I think that having those lead indicators that focus everybody on the right measures across your impact thesis, it's absolutely critical to success. Because actually, although, you know, everybody measures, in an ideal world you are measuring your achievement and progress along the, you know, the course of the delivery, in reality it is a different dynamic when that is actually, you know, part of your outcome payment framework. And so I do think that does focus everybody, and it focuses the problem solving, where if some of those lead indicators are not coming through, it can drive the you know, the hard problem solving decisions of what can we all do differently, and what can all of the parties around the table identify as the different solutions that they can bring to the table. So I think more importantly, operationally, that is really, really key to actually help that innovation, rather than just say, well, you know, we need more time and let's look at this in a year's time and then let's see where we're at, because that's kind of an easy way out.
Okay. So just, I suppose, to reiterate, level of improvement, you know, it affects the price, harder, costs more. Likewise, cohort specification, it's not necessarily quite this simple, but, you know, tighter cohorts can cost less. You've also got to take into account that if your cohort is quite diverse, you might be looking at different outcomes and different amounts being paid across the cohort.
And even on a really basic level, you know, a cohort, we could have a whole cohort payment, so you're paying for all of your cohort in one payment. Like the Peterborough, you paid X amount for an entire cohort to see a 7.5% reduction. Maybe in some of the kind of the children's, it's for each child to achieve no longer being in residential care. So it's very basic, but obviously you're only paying £100 there, and you're paying £100 times the number of people for your cohort level. And they look very different, obviously, because the values are so drastically different.
Yeah. And then Mila's explained the timing point and how that affects things, not just financially, actually, but also operationally, which I think is a really interesting reflection. The one that gets people's heads scratching is this attribution point and additionality test. What, Kat, I'm going to turn to you to this one first. What do we mean by that, and why does it affect the price?
So I think it's about ensuring that what you're paying for wouldn't have happened anyway. So in the kind of, you know, the extreme kind of example, it would be a randomized controlled trial, and you're only paying for the drugs or whatever it is that actually treats the people. I'm not sure we've ever seen a randomized controlled trial in a SIB in England.
Not in this country, no.
And so you kind of go through different stages. So the Peterborough one did some very kind of like clever analysis and looked at these people we're giving this intervention to. Oh, these people look vaguely similar. What happened to these people in the time that these people got the intervention, and did they move in different ways? And then you're kind of thinking about looking at data, like Tim was saying, about the kind of the predicted or the historic A&E use, and checking that actually it doesn't just change because of some random element. And this absolutely speaks to the fact that the kind of 5-year payments are so much more risky, because you know, all the A&Es could shut down, and so you pay a massive payment because you've reduced A&E consumption, but actually it's because of some completely bizarre element in the system. And it's about trying to make sure that what you're paying for doesn't occur anyway. And like you said, and like we keep saying, it does interact with everything. So whereas in some social impact bonds or outcomes-based commissioning, you might see a cohort that so far in need that nothing's ever going to they're never going to get to the point that you want to pay for that outcome. So actually doing this kind of intense analytical, process to make that payment is probably above and beyond what's worth paying for. But then you have kind of maybe the kind of wider cohorts where you're just looking at, young people who may become not in education and employment and training in the future, where it's more important to be putting that assessment in place to make sure that you're not paying for those kids who actually they're going to go on and get 10 A stars and go into employment anyway.
I'm just on attribution. I think it's important, to make the distinction between, just because you're paying for an outcome that's being achieved in the SIB, it doesn't necessarily mean that the whole of the work that's produced that change in outcome has to come from the SIB, because it may sometimes be that there's a range of different services out there, for example, for a particular group of people who. And what the SIB is doing is helping them to get more out of those services, for example, by getting them to turn up, or if they don't like it, to come back, So clearly, there's a contribution to the outcome that's being made by the service that they're attending. In an ideal world, though, that's priced in, So it's the additionality on top of what would already be achieved by things that people might be attending that you want to try and pay for, but it is hard to be sure, isn't it? In terms of how much that really is.
As we've already reflected, we live in a messy world, and things exist, and kids might miraculously pull it out of the bag. Analysis will only get you so far. And actually, I just wanted to make maybe a really simple point, but to Tim's point is that you need to make sure that the outcome, the interventions can actually influence those outcomes in a very strong way. And that's why all of these elements are so important. But if you specify an outcome where the intervention is never going to have that much of an impact, then you're essentially paying something that you're hoping is being influenced by all this stuff over here, and your intervention is.
Yeah, and I think that the attribution argument on a local level can be quite difficult, and I think that actually really focusing on bottlenecks and really understanding that actually for looked after children who are in care and who have care plans that say that they can be in a family environment, actually there are so many operational reasons as to why that's not happening, and these contracts and the outcomes that are set to help drive that can really unlock that. So I think that really understanding why certain things are not happening and then addressing them is a big win, and I think that's what needs to be focused on in the when one thinks about how to get better outcomes from the existing spend. Similarly, with a lot of the health projects, I think that the referrals overall are so diffused and so hard to achieve in many circumstances, and services kind of are launched with the assumption that people will generally use them, but actually getting that ongoing activity is really, really hard. So I think it is about also really practically identifying the bottlenecks and the barriers that are actually existing, and creating incentives that enable for that to be removed, and for outcomes to be achieved in spite of that. So I think that is really, really important.
Okay, so this all feels really tricky. So let's talk about engaging the market, because this is potentially a way to try and find your way through this. And I know we've had a few questions. I will leave some time for them, don't worry. But as you're trying to figure out what the effect might be as you try to adjust your price for level of improvement or cohort difficulty, all the timing of payments and so on, from the commissioner's perspective, you're trying to work out what that means for the price. How do you need to adjust the price according to your preferences on that? And perhaps one of the ways to get some insights into it is to ask the market, because they will be extremely sensitive to those factors and how it might affect their chances of achieving the outcomes and getting the payments. So how, if we all acknowledge that this market engagement is really important to get this right, how do we do it? How do we do it in a way that means that we can still be assured that we're getting public value, and we're not sort of being ripped off, I suppose, to put it really bluntly. But also, why is it so important? What's the danger if we don't do it? And I think, across the panel here, we'll have perspectives on both of those things. But perhaps before we talk about the dangers of not doing it, which I'll turn to you for, Mila, perhaps we can talk about how we can do it and get the insights from the market in a way that won't sort of undermine the public value case. And you said yourself earlier, Tim, perhaps we paid a bit too much on the Fair Chance Fund. So how do you do this well?
Well, I don't know. I think it's certainly the social impact ones I've been involved in as a commissioner. I've wanted to engage with the market right from the start, and that's, it's not just been about getting the price right, it's also been about getting the outcomes right and actually saying, well, how are we going to do this in a way that it really is going to deliver the maximum benefit to the group? Is it feasible to do this in the first place? Is it going to work? Is this something that you would want to subscribe to and perhaps be involved in? So there are those reasons for market engagement. So you're bringing people along with you so that when you eventually get to the point where they're going to bid, there'll be some people who want to bid. But also, as a commissioner, although I might have known about a problem that I wanted to solve, I didn't really have the sort of detailed insight into what would be necessary in order to solve that problem. Much more chance of people who are already working with the client group that they would have an idea of what that might be. And so I've tended to have meetings with people and sort of ask them either directly or in a survey afterwards, broadly speaking, what do you think this outcome might cost to deliver if we were going to go ahead with it? And then you get a range of feedback, and you can sort of think, well, somewhere in the middle of that might be about right. Is there any consensus? Does anybody actually have an idea of what this is really going to cost? Because if you're doing something new, trying to achieve outcomes that nobody has really measured properly before, then it may well be that the voluntary sector themselves don't actually know what it's going to cost. And there is a phenomenon called optimism bias, which Mila's nodding at me now, because providers of services in the voluntary sector will sometimes think that they're going to achieve better outcomes than they really are, because rightly they're proud of their services and so on, and they may sometimes ignore some of the things that don't work quite so well because they're focused on the things that they know have worked well in the past. And so you have to be careful that if you just go on the basis of what providers say they think they're going to achieve, then actually they might overestimate what's really possible. And so it's important also to engage, as early as you can with people who might be investing in this, who typically will know less about the subject, probably, unless it's something that's already established for social impact bonds, but probably will be more skeptical and more understanding of actually, statistical likelihood of outcomes being achieved and risks and so on, and naturally more cautious because it's their money in the end that's being put on the line rather than the providers. So I think an early engagement is really good to get you to get a starting point for what things might actually cost to deliver and whether they're feasible or not. But also, as you go through the process, it depends on which sort of procurement process you want to use and so on. But competitive dialogue can be a very useful way of going about it, where you get a number of potential providers who passed perhaps an expression of interest test, so that you think they're seriously able potentially to do this work, and you talk to them about is this the right outcome? What is it going to cost? How should we be measuring it? What's feasible in terms of measuring it? How burdensome is it going to be for you if you measure it in a certain way, and how much cost is that going to add? So you can do those sorts of things, and then potentially get to a point when you're actually commissioning it, where certainly if you're using a rate card model, you can set a maximum price and then allow some real competition in the market to reduce that price to what's really feasible. Now that's all fine if you've got a competitive market. Quite often in these situations, you don't really have a competitive market. In fact, you might just have a provider or a consortium of providers who come to you as a commissioner and say, we'd like to do this. Here's what we think you should be charging for it. And in which case, as we discussed already, it's important that you would know as a commissioner that what they're thinking of charging you for it is worth it to you. But that's not a sufficient test. You also want to know that you're getting value for money. as best as possible. And so I think it would be not unreasonable, particularly in that case where somebody's coming to you, that you would want to have some transparency about what they think their costs are going to be and delivering those outcomes that you can look at to assess, well, actually, you know, is this reasonable? Does it make sense compared to other things I know about, other things I can research, other providers I can talk to who might have done the same kind of thing in the past? You know, do the investor returns that have been priced in here look as though they're reasonable, actually, considering the level of risk and so on. So I think, you know, market engagement one way or another, you know, at the beginning, but also throughout the process is really important. But it's also good if you can to have an actual sort of competition at the end that really gets
if you've got a competitive market.
Price.
Okay, so by the sounds of what you're saying, this, you know, having sort of done your theoretical starting point and perhaps made some adjustments, at the same time as doing that, you're also talking to the market, figuring out what they think it's going to cost based on what you want, and adjusting all the different parameters as you go based on that, I suppose. Mila, how does it feel from the other side? Obviously, you know, your investors, you work closely with providers. Why is it so important that you are engaged early on and throughout the process?
Yeah, no, I think that in terms of the partnership that's being established, it's every single party needs to get comfortable with the partnership. So I think it's important to develop that over time. And I think when that's developed and when people, you know, can talk and look each other in the eye and figure out what we're all committing to achieve here, then things can be designed in ways that that everybody's comfortable with, and probably more innovative and more impactful things can be created that way, rather than trying to, you know, create something that's really transactional and there is no room for dialogue, discussion, and building of that trust that we're all working towards the same thing. I think it is, I mean, I don't think anymore, which is really good, but historically there has been a rhetoric around, you know, outcomes contracts are completely risk-free for the commissioners, and that's just not true in any way, because there needs to be, you know, yes, the payments are linked to outcomes and the payments are not made if the outcomes are not achieved. However, the problem solving and the obligations need to exist on all parties, because actually it is that only if the collaboration is effective, this can work. In particular, where, you know, the referrals are coming from the local authorities and depend on many local authority processes. If none of those are working, there's nothing that, or there's very little that that, you know, people outside of the authority can do, or the impact of what they can do is limited. So I think having early engagement so that all of those points can be discussed and you know, solutions identified, that it is really important, and the likelihood of actually getting to the final line is much higher. I think that in processes that are incredibly transactional, we had situations where we completely had to you know, either pull out from procurement processes or withdraw from procurement processes, or you know, choose not to be a part of it, or where things potentially didn't get launched is because it was a very transactional process, and it seemed that for, you know, either there was no room for dialogue, so one couldn't really, the only answers that one would get to potential questions were, you know, very unimaginative no's. And so I think finding ways to address that is really important. And I do think that figuring out how to kind of think through the practicalities of delivery and really highlight different scenarios that can happen and questions that arise from that early on, I think is really important, because then you can ensure that the right processes are set up, but also the right governance is set up, and, you know, everybody's focusing on those practicalities rather than kind of thinking about a theoretical possible way where there is an infinite number of possible scenarios that can pan out. And I think thinking about how to really set things up operationally for success is really, really important. So again, it's just having the ability to have dialogue and to talk to people who are responsible for it is really important. And I think that again, because a lot of the work is during design, you know, whether it's central government, whether it's policy, teams who are designing something, or whether it's, you know, the commissioning and the strategy teams within local authorities. In the delivery phase, the actual contract management then gets moved to a different team. So how do you, and that's in, you know, in central and local government. So how is that consistency managed, and how do you not lose everything that was agreed or co-developed during design, you know, over the course of delivery? That is an important point as well. And then finally, how do you also ensure that you are engaging all of the operational individuals who will actually then be involved in the day-to-day delivery? So not just managing the contract, but also involved in the day-to-day delivery, because those voices are critical during the development time.
So I want to pick up on one point in particular, actually, which is this point about, you know, the contract management being done by a different team, because it relates to a question that's come up a couple of times now, actually, which is a really good one, which is, can we change things after the contract has been launched? Can we change the price we're paying for an outcome after the contract has been launched, or is that cheating? Is that moving the goalposts? Now we've seen that happen. What's the answer to that question?
I mean, I think if you're promoting, you know, if the idea is innovation, and if the idea is managing things in a way that you are wanting to, you know, continuously improve, then saying that actually everything that you designed is rigid, it completely kills the idea of, you know, actually driving change and improvement. So I think that actually you should have sensible mechanisms for reviewing that. You know, whether that ends up being the final answer, it will depend. And again, it will need to be done through a sensible process, because obviously, if, you know, nobody will want to sign up to something where any of the parties will say, well, actually, by the way, in 2 years' time, we can completely change all of this. You know, that just doesn't work. So there needs to be a way of reviewing it and potentially changing, you know, some aspect of it because learnings came up, or the external circumstances changed as well. You know, there could be, for the Youth Engagement Fund, the definition of attendance changed completely. So I think that there are, over the course of the contract, so I think that there are internal and external factors that should be provided for, analyzed, and a forum for sensible discussion needs to exist so that that can be reviewed and changed if appropriate.
And it's interesting about the Youth Engagement Fund. So obviously there was a kind of previous fund, the Innovation Fund, that they then used the learnings from. So that gave a chance to reflect, see what had been designed well, what hadn't worked quite so well, and they ended up changing the cohort definition, as I understand it, moving into the Youth Engagement Fund to ensure that they could target younger people. And I think when we're looking at some of the early evaluations coming out of the Youth Engagement Fund, there were certain projects where the outcomes that the providers could achieve were tied so tightly at the beginning, it kind of hampered them to those. They were stuck on those ones, whereas they might have achieved more when had it come to achieving other outcomes. I think there are probably going to be some interesting reflections from the Life Chances Fund in this area. So some of the projects, I believe, are either kind of transitioning from already existing pilots, so they're doing that kind of engagement, and the partners are kind of working together to work out what will work best in the contracts. Or there are some that are even looking at maybe running a 1-year SIB with the anticipation that you then kind of change it at the end of the year, which is a really interesting method.
We tried something in the Brent homelessness prevention SIB where it runs for 2 years, I think, and two years worth of intake anyway. And what we said was that after the first year, we would look at the ratio of outcomes payments to what the providers had actually spent to deliver the service. And if that was more than 10% different either way from what was predicted in the bid, and then we would have a right to move the price up or down. Right. Now, it's not perfect, actually, because all sorts of factors would be different from the first year, from the second year, and so on. But something like that, because as Mila says, the trouble with just having an open-ended, we can review this price after a year, is that it doesn't tell you who's going to decide on what basis that price would be reviewed. And so you know, it may well be that it can be amicably agreed, but if you can think of a way of putting something in your contract or grant agreement that as a trigger, then that might be helpful.
Yeah, and I think as Kat said, and we have done that in some of our projects, is that sensible baselining. So thinking about it as a 1 year plus 5 project or
Yeah.
whatever it may be, because actually that then creates a way of creating a sensible baseline, getting good quality data, but also getting, not needing to build, as what we said, not needing to figure out what the potential success rate is in 7 years' time when you just have no idea right now because you're working with something completely new. So figuring out the right baselining is actually an approach that we are doing on some of our projects and can be really effective. And sorry, there was just one point that I wanted to reflect on, I didn't previously, on your testing the value for money. And I know we bang about this all the time, but yes, testing value for money, but obviously incredibly important, but thinking about it in the context of cost per success, rather than trying to identify and dissect every single possible delivery aspect of it, because actually you want to incentivize the changes in the delivery structure. So I think that's important.
Absolutely, I think it's a sort of compromise, isn't it? Because you don't want to end up paying 5 times more than your budget because something has really succeeded extremely well, even though you're delighted that it has achieved as well as that. But at the same time, you want to allow freedom and possibility for the investors and providers to succeed and to get some reward for success.
Great. So I think we're going to have to leave it there. I hope it's been useful. I think the overarching picture is that there are multiple factors to take into account here, and not only do they all need to be taken into account, but that dialogue and engagement with the market is really critically important in order to get this right and price your outcomes effectively. We are developing some guidance, some technical guidance on this topic here at the Go Lab. We have started the research on that and got quite a long way through it. We're going to use the insights actually that our speakers today have shared with us, and all of your questions, both those submitted beforehand and those submitted during this webinar, to inform that guidance and make sure that we are answering the right questions in the right way, basically through that guidance on pricing outcomes. So hopefully we've given you a flavour today. If you haven't quite grasped everything, don't worry, because we will get it all written down as best we can and put into a guidance document, which you'll be able to use and consult at later points. So that technical guidance will complement other technical guidance that we have available on our website. So do check that out. And we also have a webinar, as I mentioned earlier, next month, which is on measuring the impact of your outcomes-based contract. So evaluation, and again, it touches on many areas we will have discussed today, but we'll go into more depth, particularly on the impact measurement piece. If you would like to speak to us directly, please do go ahead and book an advice surgery. We do sometimes involve some of our fellows of practice in those advice surgeries, where if we get out of our depth, we can invite some of our fellows of practice to come in and help with your queries in advice surgeries as well. I think the only thing left for me to say is, well, 2 things actually. One is, do please fill out our feedback survey. I think the link is up here on the screen. Just go to slido.com, type in that hashtag pricing outcomes, and do give us your feedback on the session, please. It's always very useful for future sessions if we have that. And then the final thing is, thank you very much to our 3 speakers for sharing your insights so openly and for trying to explore some of these tricky issues from multiple different perspectives. Thank you all for coming up this morning and sharing your insights with us. And thank you all for joining us.